Hello everyone, Namaste. Welcome to the FitNCalm Sunday webinar series. I'm Tejasvi. I'm a yoga teacher, and through FitNCalm, we love to share with you yogic knowledge and how to do yogasanas and a little bit of ancient scriptures knowledge. Yeah, and today on this webinar, I'm really glad to introduce my dear friend, Dr. Tuheena Sharma. She has a bachelor's in physiotherapy, and she's an ortho and a sports physiotherapist. She's been working for 7 years with the athletes and dancers, and also people who suffer from yoga injuries. And she is currently leading the physio and the sports injury clinic at Hyderabad. She's also an art of living teacher. And Tuheena, over to you.
A very good evening, everyone, and I welcome you for the today's session, which is on yoga injuries and prevention. So, am I audible clear? Yeah, visible and audible clearly. Great. Okay, so I'm going to share my screen. Very much thank you for inviting in the first place, and Tejasvi for the sweet introduction as well. And yeah, so I'll just be sharing my screen. Just a second.
It'll be great if everyone can turn on the videos. It'll be good to see your smiling faces also and to interact with all of you. And also, if you have any questions, you can put it up in the chat box. We will address it towards the end. Yeah, Tuheena, sorry, you can continue.
Yeah. So, is the screen visible?
Yes,
Yes.
it is visible.
All right. So, yeah, as we said, we're going to talk about yoga injuries and their prevention. So, yoga injuries, like any other injuries, because yoga is in itself a movement flow, right? So, humans, they have a very complex movement ability. We can swim, we can run, we can dance, we can do yoga, we can do a lot of things. We evolved from being on all fours to standing, and then we really mastered movement. Now, coming down to what is yoga, I'm going to focus primarily on the physical aspect of yoga, which are yoga asanas. So, what are yoga asanas? They're basically a synchronized movement at multiple joints. It occurs in a flow and it's coordinated with breath, right? So, if you're losing on any of the components, the synchrony, the movement control from the various joints, the muscle work, the coordination, if we are not coordinating with the breath within the muscles, we can end up in injuries. So, coming down to the types of injuries, now any injury, whether it's an athletic injury, whether it's a dance injury or a yoga injury, it'll be either acute or chronic. Acute is something that just happened, you slipped your hand while doing a handstand and your wrist hurts or your elbow hurts. It's red, it's swollen. That's an acute injury. It's very common in yoga, which demands a lot of strength and stability as a prerequisite. I could say the Ashtanga yoga, the power yoga, it demands that you come from a place where you have a lot of strength already and then you are able to administer the movements. So, those are the types that will end up in acute injuries. But when we talk about Hatha yoga, vinyasa flow, where it's more of a smooth movement happening, repeated malalignment, repeated overstraining leads to more of chronic injuries. You might be doing a posture wrong for a very long time in the wrong movement pattern, stressing out your joints, ligaments, muscles, and it results in a repeated strain or a repeated sprain, which could be to the ligaments or to the joints or to the muscles. Yeah, so those are the two types of injuries. Now, what are the common causes? How do we end up in injuries? We've already entered that as we talked about the types of injuries when we talked about the faulty movement patterns. So we will go one by one. The first and foremost, as I keep listening to Tejasvi and Khushpinder also in all their videos, they emphasize a lot on listening to the body. And this is the first prerequisite for yoga, right? Every time you go into a pose, you know you're not comfortable at one particular point. You need not push yourself too much to achieve it. You're just pumping up your ego, not doing the posture right. Yeah, so the first one is listening to your body. The second one is faulty techniques and faulty movement patterns. When we talk of this in the sports world or in the exercise world, we call it wrong movement mechanics. Now, yoga is somewhere where we are combining multiple joints to work synchronized in a particular flow in different positions, standing, sitting, lying. So that coordination between the joints, the angles, that's very important. And when you do faulty techniques over the period of time, that's when you land in injuries. Now, how will that be prevented? That can be prevented when you have a teacher. So there should not be an unsupervised practice, I would say. It's good to practice under a teacher. It could be you might be following a YouTube channel. It could be it could be an online medium, but a regular communication with the teacher as to what are the movement patterns that you are doing, what are the challenges you are facing, what are the areas that you feel are tight, are weak, or you feel uncomfortable with what kind of workouts. Yeah, so that's about doing a supervised practice under a teacher. And then overexerting and overstretching. This has become very common with the yoga community. Everybody wants to do yoga, and we really directly want to do a split and a headstand and a handstand. Yeah. So even in our regular postures, we want to achieve more. If we are doing a bow pose, we want to be right there. So listen to your body again. Overstretching is only going to lead to ligamentous laxity. It can lead to a number of issues later on. Yeah. So and second thing which which is particularly very specific to yoga, we are able to achieve certain asanas and postures which are beyond the normal range of motion of the body. So to achieve that, you have to first have a very strong base of core and a very good stability. Without having that, when you want to achieve that extra range of motion, which is not within the normal limits of a joint, you're going to end up in injury. So there is a step-by-step procedure, over achieving that extra range of motion. And it is not just learning a yoga posture, it's a skill acquiring process. It has to happen under a teacher. It has to happen step by step. It has to happen not holding your breath, breathing in and breathing out. Yeah. And when we exercise, we emphasize so much on warm up. It equally applies to yoga as well, right? So generally the warm up is divided into a general warm up and a specific warm up. When we really talk about it in the sports world, I would say if you're a beginner in yoga, a general warm up like a neck roll, shoulder rolls, bending forward, bending backward, doing some muscle activation for the core, most importantly. These should be a part of your warm up routine. You should let your body really warm up, let your heart rate increase, and then get into your practice. Whereas if you are at an advanced, intermediate, or an advanced level, it's really important that if your workouts are going to be more of upper body, where you need to stabilize on your wrists, where your upper body needs to take the load of the body entirely, you really need to do a warm up which is specific to the upper body so that each and every small muscle in the upper body is warmed up and it is attentive to the demands that you are going to throw on the body. Yeah. So warm up is very essential. And then we tend to do this, we know yoga is therapeutic. So we think that injuries can be fixed without going to a doctor, without going to a physio, just by doing yoga on your own. That's not absolutely right. You really need to fix the pre-existing injuries that you have. Visit your physio, figure out what are the weak links, what are the tight links. Make sure that there is a communication between your doctor or the physio and your yoga therapist so that at the end, when you have completed your rehab, you have done your pain management, and you end in yoga, your therapist is able to take care of those weak links, and you do not fall back in the cycle of pain, pain and struggling through it. Yeah, so it's really important to have, I would say, a strong foundation of framework before you try going experimenting with movement. Yeah, and then working with the pain is a big no. You feel that every time you try to do something and the front of my shoulder hurts, you really need to get your shoulder checked, get it fixed, and then go ahead with it. Tolerating the pain and going through with the postures is only going to worsen. It's only going to worsen the existing problems, and once it becomes chronic, it becomes even difficult for us to fix it. Yeah, so no working through the working through the yoga class with the pain. And now many of us, this weekend warrior is a term primarily in the sports world, and we have a lot of over enthusiastic yogis. Everybody wants to do yoga, and so the one day that we find, Saturday or Sunday, that we have time, we really want to do like a 2 hour long yoga class on our own, or unsupervised. And it is not going to really work very well with the body, because suddenly so much of load is imposed. You've not worked on your mobility, your strength, your endurance for the entire week, and suddenly you're loading yourself with a yoga class. So I would say that it's there's no harm in doing once in a week, but you have to really know where you are being over enthusiastic and you are putting unnecessary demands on the body. That's very important. Now when you begin yoga, it's also important, and as you've been practicing, are you doing the necessary core stability work and the muscle strength work that you need to do? So one good thing is, yoga itself will take care of a lot of your core stability and muscle strength. It will come. You will start recruiting your muscles way better when you practice yoga. But at the same time, if you really want to improve some specific muscle strength, for example, every time I do upper body posture, my left shoulder, I feel it a little weak. It doesn't hurt, but it is a little weak. I really need to specifically work on the strength of my left shoulder, particularly. So that becomes a situation where I will go back, I will work with my physio, improve the strength of my left shoulder, come back and improvise it into my yoga routine. So the shoulder doesn't become a barrier for me to doing yoga poses, which I could have otherwise done, right? So that's very important. You have to match up your strength and core stability to the kind of demands that you're putting on yourself through the yoga. Now, many of us, we do not have a clarity over the level that we are, whether we are a beginner, are we at an intermediate level, or if we are starting, can we directly start from intermediate level if we have been doing a good strength and conditioning or Pilates for a long time? So we really need to be clear, where are we in the first place. If we are a beginner, there's no chance, I would say, that you should start off just looking at some random videos or reading some books. I would say it should be guided under a teacher. And if you are an intermediate, if you're an advanced level practitioner, I would say even for an advanced level practitioner, it's very important to be guided, because the movements are way more complex and tricky. When I look at the strength and conditioning world from where I come, doing higher level things without a teacher is still easy in the exercise world. But in yoga, looking at the complexity of the movements and the balance work that is required of the body, I would really say that it would be good to again do it under a teacher. And also the style of practice. Now there are certain factors that we don't keep in mind, or we are not aware of probably in the first place. There are different styles of practice. There's hatha yoga, there's vinyasa, then there is the power yoga and the ashtang, which is really demanding. So the style of the practice you have to decide based on where you are in your movement health journey. Where am I standing today? What is my age? Am I putting age appropriate demands on my body? Am I already hypermobile? And what is the kind of style of yoga that will suit me if I'm hypermobile? So all these things are very important, and your yoga teacher will really be able to help you through that. Reading up also will help you understand what is the style of practice that you would want to do for yourself. Hatha and Vinyasa flow, which Tejasvi and Kush have been teaching, is really good for beginners. It's really good for intermediates to go through, and the way the videos are, the chances of going into injury is really less because the modifications are also shown simultaneously. So that's one point that's very important, which I want to cover under that over enthusiastic yogis, that you're not able to do a chaturanga, put your knees down, don't push yourself to be there, do the modification, listen to your body, and you're going to get there one day, right? And many of us, each one of us wants to do yoga, and we see everyone doing yoga, but is it really a goal oriented practice? What are you really looking for? When you enter strength and conditioning, you know you're looking for strength and conditioning. When you do Pilates, you know that you're looking for a lot of core control in your body to develop and have a lean body. Now you're entering yoga. Yoga offers everything. It offers weight loss, it offers a lean body with a strong control. It offers immense mobility with a good stability. It offers, relief from health issues like PCOD. There is yoga specifically designed for pregnancy. So have a clear goal in your mind, that why are you really getting into it? Is it because everybody is doing it and it has become a trend? Is it because it is cool? Or you are clear why you want it, why you want to do it? So that's one of the important, I've put it in the course, but it's something that we need to bear in mind in the first place as we are stepping into the practice. Now, having enlisted the causes, the common causes leading to yoga injuries, I want to touch upon some of the common injuries which we see on a day-to-day basis. So wrist injuries are very common, where we have to balance on our wrists, like we were talking about chaturanga. Lower back injuries are also pretty common. Shoulder and elbow injuries. Let's cover one by one, because there are slides which will show you that what happens in a wrist injury, when does it happen, and what are the common postures. We are going to cover the example of chaturanga for the wrist injuries. Now, chaturanga is actually a part of your Surya Namaskar, the sun salutations, right? But the it happens so quick that it ends up to be a very sloppy chaturanga. So, what is important to know about chaturanga, I would say, is that it requires a very meticulous alignment and very specific muscle engagement. So it is actually more demanding than a push up. I have been doing push ups all my life, like I remember from how long I have been exercising. But when I did chaturanga, I realized what are the demands that it puts on the body. So the first thing that I want to pinpoint here is that how you can start from a plank and gradually get into the posture. And it's very important that you lower the shoulders to the elbow while exhaling, and the shoulder should not fall below the elbow. Or the second thing that can happen is your elbows can buckle out. You could use straps, you could use props to make sure that the alignment is good. And this is the ideal pose, and nothing in the world that's ideal that can be achieved in a go. It has to go step by step. So there's no harm if you feel like putting your knees down. There's no harm if you want to put a prop across the elbow to elbow, like a strap which maintains your elbows in place. And if you're not able to go all the way down, I guess that should be fine as well. Yeah. Now, having said that, as we were talking of warm up, there are specific warm ups that can you can do before entering into a specific pose. If you're looking at mastering the chaturanga, right? In case that is the goal, then you can go for the different postures which can help warm up your upper body as well as your core. Yeah. So for the upper back, you can do the Shalabhasana, which is the left lowest picture. It really helps work your upper back muscles. You can warm up your core by the boat pose. Now, the boat pose here is very ideal again, and wherever you are is, I think that's fine. You should be able to hold, do a few repetitions, and you're going to be fine. The third picture from below is your Gomukhasan, and you might not be able to touch fingers to fingers, and that should be absolutely fine again. It the Gomukh will help you open up the front of the chest, open up the hips very well, right? So these are the asanas. The third one is the eagle pose. Again, basically getting you that flexibility and mobility before entering into the chaturanga. So you are working on your upper back, you're working on your core, you're working on your mobility to open up the joints. That's your preparation for the chaturanga, so that you are able to do it correctly without faulty mechanics, without falling down, and you're able to sustain the hold. So that's about the warm up. Now, when we talk about the lower back and your knee injuries, the lower back and knee injuries, they're very common in forward bends and also in twists. If you're not going slowly in and out of the twist, there is a chance wherein you might strain your lower back, you might strain your hamstrings. So the picture here that I have put for the twist is deliberate, that there is a a super band which she's using to help her go into that range. So what we generally do is we want to do it without using anything, whereas using some prop will actually make you achieve better in terms of range of motion, in terms of control both, and it will reduce the chances of injury quite much, right? And you will do the posture in the right alignment, most importantly. And what we do in our forward bends, ideally, when we are forward bending, all your anterior abdominal muscles should be contracting. And that's when your muscles on the back will be able to relax and elongate and give you the range that you need to go down. Right? So, engaging the core becomes very important in your forward bend postures. So, not just your forward bend, one thing I really would want to highlight here is as many pictures we see, and even the ones that we don't, whether you're trying to achieve something with the upper body or the lower body, the core is fundamental. Making sure that you know how to activate the core and be able to sustain that activation itself is 80% of the job done, right? So, coming back to the forward bend postures, I also have put this picture deliberately because if you see, the knees are arching into hyperextension. So this is what we tend to do in the standing posture. Sometimes we don't use that small knee bend, which if we use will prevent our knee joints from straining, and we will end up recruiting the muscles which are actually sleeping. So here in this picture, the knee is absolutely strained, I would say, because you're going into an hyperextension and you're not using the control from the front of the thigh muscles, from your hamstrings, from your quadriceps, and it leads to the grinding of the joint over the period of time. It will lead to degeneration. So that's about all your forward fold postures and lower back injuries. Lower back injuries are also very common when you try to achieve difficult balancing postures and asanas, because that can lead to a fall. And a fall on a buttock is a very common cause for a lower back injury again. Many of us look towards doing a lot of lower body, lower back workout to achieve that flexibility, because we have sitting jobs and we tend to sit for long hours and our backs feel stiff. So we really look to opening up our back through yoga, and as we open up, we develop the ability, not the ability, we just love cracking our backs basically. It's not a good practice. It basically leads to degeneration of small facet joints in the spine. So your spine is like this, vertebrae stacked one over the other, and they're supposed to glide this way. That's the only movement that happens in them. And when you start cracking your back more often, twisting around, you're just causing every time the joint to grind against, the two surfaces to grind against each other. So that's not a very good practice to do. So, having said that, now a lot of head and neck injuries happen when you want to do the headstands and the handstands, right? I've put three different pictures. All three of them are correct. None of them is wrong. So the message that is being conveyed is wherever you are, that is your Sarvangasana, right? You will achieve the center one, but as of now, wherever you are able to do, it's really good if you're doing it with a good balance, engaging your muscles. That's more than enough. Otherwise, when you attempt directly for going into the picture in the center, how the man is directly standing on his shoulders, and yes, people are able to remove the hands as well and be there, trying to achieve that directly, that is when you end up in shoulder injuries, that is when you end up in neck injuries. And shoulder and neck injuries are not minor injuries like your knee strain or your hip strain. They can be devastating to the point if you have a vertebral collapse, it can be really bad, which is more common to happen with a headstand. So, yeah, first thing I would want that a headstand, if you really want to, again, it is more than a yoga posture. Look it as a skill acquiring process which requires time and guidance under the teacher. So even if you are looking at a tutorial and doing it, that's fine, but know the steps that you have to go through to be able to reach the last point. Use the wall, use the support of the arms more, increase the stance of the arms so that the base of support is larger and you're able to be there, and then finally try to achieve a proper headstand. Now, all your standing postures, your hip knee alignment is something that we really talk a lot about in the physio world, which is very important to make sure that you are not grinding your kneecaps against your, against your thigh bone, to make sure that your ankles are mobile enough. So this is something, actually not just hip knee, it's hip knee and ankle alignment. Most of the knee issues, they start because you don't have the opening ability in the hips. So you generally tend to have tight hips, and then you are entering into asanas which demand the knee to be somewhere. For the knee to be somewhere, the hip has to really open up. So that ability will come when you first work with your hip mobility. So yeah, so that's one predisposing factor which leads to any lower quarter injury, that is not having a very good hip flexibility. Second, 80% of the people who have not been working out and are into sitting jobs can take this from me that they have a glute amnesia. Their glute doesn't work, right? It has forgotten what it has to do. Trust me, it's a medical term which has been proven, and there's a lot of literature that backs it up. Yeah. So so you need, if you want your hip knee and ankle alignment, you have to make sure the core is working in synchrony with your glute. Both of these are prerequisites to form a good foundation, and then is the mobility that is required from your ankle as well as from your hip on the top. Otherwise, either one of them, when they fail in the required mobility, the brunt comes to the knee. That is why many of us tend to have a inner knee, they call it as a medial knee pain. That's very common. Many of them will feel the IT band which runs on the outside of the thigh from the hip to the knee, will feel that their IT bands are really tight. Basically, your glutes are not stabilizing your knee enough as much they should, and your kneecap starts grinding under the uh, against the thigh bone. So that's how all your knee issues dwell. And many of us also do not have the mobility in our posterior ankles. The back of our ankles tend to be tight. So you can check for yourself, sometimes if you put a plate under the heel and then do a squat, you will be able to do much better compared to doing it straight away down, because you don't have that range in your ankles, because we never utilize that. We tend to do heel raises, but we don't really drop our heels keeping our toes somewhere. That is never that never happens unless you are doing stairs up and down. So having that mobility in your ankle, having that mobility in your hip, the strength in the muscles, the core, your glutes, and then of course your hamstrings and your quadriceps. Now what happens, so that's about the alignment and the injuries which commonly happen. uh, With the knee, what also commonly happens is your hamstring, the muscle right behind on the back of the thigh, it's a long muscle. It's also called the runner's muscle. It's very well developed. They use hamstrings a lot. When you do a lot of forward flexing postures without engaging your core, you actually irritate the origin of the hamstrings, which is somewhere in the buttock. Where the buttock meets the thigh is where your hamstrings actually originate. So you do not engage your core in forward bends, and it constantly irritates. That's how many people will develop a pain in the lower buttock area who have been doing yoga without engaging their core. So the lateral band, the outer thigh IT band, and the hamstring strains are pretty common in the population who have not been using their core and have been, following a faulty muscle recruitment technique. So having said that, um, hip knee alignment. And the splits, yes, dancers want to do splits. We yoga enthusiasts want to do splits. All of us want to do splits, right? Uh, Now, first thing I want to tell you is the normal opening ability of the hip is 0 to 45 degrees. That's what God has given us. This is something that we are trying to achieve beyond that, right? So, if you're wanting to achieve that, it has to be really, again, very graded. It should be a goal. It should be like a 2 month goal, is what I would say. It is not something that one fine day you start stretching into it. You have to make sure that your glutes are firing. You have to make sure that your adductors, your inner thigh muscles, they are elongating, and they also have the control. Because when we achieve length in the muscle, we tend to lose the control. So it's very important that you're elongating, you are achieving the stretch, you're opening up, but at the same time, you will not lose the control as to break down from the center, right? So that's about the splits. I have myself not yet even tried working towards it, and I would say again, even for myself, I would do it under a teacher, under the guidance, and that's how it should be. Right. So a split is the most common cause of groin injury. I would want to tell most common groin. I have treated a yoga therapist, a beautiful yoga therapist, and she had also suffered from a groin injury. I've seen her for a month, and it was a bad injury because she tried going back again, treating with the yoga, with the posture, slowly going into the movement. It only became chronic over the period of time. So really listening to the body and giving body the time to heal. Injuries will happen. Athletes will have injuries. I will have injuries. You will have injuries. At one point or the other time, we will have injuries. It's going to happen. How much ever caution you take, at some point you can get injured. But it's very important to know the healing time frames, right? A muscle takes a minimum of 4 to 6 weeks to heal. That much time you have to give to the muscle. You have to do whatever. If it's very acute, you have to take anti-inflammatories, pain relief. You have to go for the physio. You have to slowly do the rehabilitation with the physio, the exercises in bed. Then you will get on the mat, and then you will get on to the standing postures. So that's how it should go when you have sustained an injury as well, right? So now, having said that, we have already covered a lot about how we could actually prevent injuries as we have been going through the images. But I still want to emphasize on these points very strongly, that make sure you choose your practice wisely. Know that what is your goal and why you want to choose that particular, school of yoga. And it's good, I would say, as much I have learned from Tejasvi and Pushpinder looking at their videos, I feel it's very good to go with the flow and the hatha yoga style for everyone to begin with, or even for intermediates. um, Next, I don't think we really go for a movement screening ever. How many of you would have visited a physio to get your movement tested? We go for a heart examination. We will do the entire blood profile. We'll go for a cardiac examination. We'll go for our blood profiling for the joints and everything. But we hardly go and get our movement tested, which is so necessary for us, right? So I would say getting a movement gram done with a physio is a prerequisite before entering into anything, any kind of practice. It could be a sport, you want to learn to swim. It could be you want to, become an endurance runner, or you might want to become an advanced yoga or an intermediate or a beginner in yoga. It's really good to go find out what is your body type, what are the tight links and the weak links, because a very rigorous examination happens muscle by muscle, wherein you will get to know what are the muscles in your body that are tight, what are the muscles in your body that are weak. uh, what is your resting posture? Is your resting posture already screwing up the way muscles should work in the body? Are you sitting slouched all the time? None of the core muscles are going to work if you're sitting slouched all the time. Do you have a chin poke posture? None of your neck stabilizers are going to work if you have a chin poke posture. So is your resting posture good for you to enter a certain kind of movement practice? That has to get established with a therapist. And yeah, there are preventive exercises you can do, so that when you enter yoga, you enter swimming, you enter exercise, you don't come back with injuries, right? And you have to recognize your personal limitations. For me, my left shoulder is a limitation, and I stop myself when I know that there is something tweaky going around there while doing my exercises. I know that my endurance is not great. I have to stop the class at 40 minutes and I cannot go beyond that. I have to maybe increment it 5 minutes over the period of time. Say I'm 50, I cannot do certain forms of yoga because of my age. Say I'm hypermobile, all my joints are overly flexible. I don't want to get into a yoga routine where there's a quick change of movements and going to extreme range of motion. I would want to do something which provides more stability, because it is going to help me control the ligamentous laxity that is there only with me, right? So recognize your personal limitations. Some of them you would know, many of them you will get to know when you go to a physio and you get a movement screening done, or when you talk to your yoga teacher and tell all your existing complaints, all your existing factors with regards to age, gender, everything, right? And it's very important to attend long standing pre existing injuries. We know the neck, there's a particular point on the back of the neck, it hurts every time I try to do something with my body, but I still do it. So as of now you're fine, you're young, you might not, really perceive it, but over the period of time it is going to give you trouble. And more than that, it is going to be a barrier for you in achieving something that you want to achieve in your movement health, right? So attending to long standing pre existing injuries which have been neglected for a long time is very crucial. Following up a warm up routine as we saw in chaturanga, likewise, a neck roll, a shoulder roll, something should be there in your warm up routine, a quick 5-10 minutes warm up. And when you warm up, unlike any other movement school, yoga is a really mindful practice. So you really make sure that you warm up your mind as well. It's very important that it should be there, it should be present. Otherwise, you will never know when you end up overstretching, you will never know when you will fall. So it has to be a blissful practice, which is really mindful. You have to do some breath work, chanting, whatever works for you, and make sure that the warm up is directed to the mind body connection and not just to the physical body. Yeah, yoga under guidance and teacher, I have emphasized enough. And using props and modifications, okay, this is new to me as well, but I'm really liking it because it helps me achieve something that I really want to achieve without straining myself here and there, right? For example, we talked about, using the rope from elbow to elbow in a chaturanga. We talked about using a super band when we were doing the twist. Like that, go ahead and find out blocks. I've seen Khushpinder using a lot of times a folded blanket, which it really helps you not overdo, right? So yeah, small things in your home can actually be your props. And modifications is, you know best when you are trying a posture where you need to slow down. Do I need to put my heels down? Do I need to put my knee down? Do I want to stop at this range of motion? uh, I cannot do a complete lift. Should I do a lesser one? So that is what I mean by modifications, right? There is no shame in doing less or not being able to hold a particular posture. right? And then locking of joints. We saw that knee, how the knee was locked in a forward bend. Let's avoid doing that. Likewise for the elbow, sometimes, what pose is this? It's a warrior pose when we do this, both the arms and going forward. I think it's a warrior pose. So, Tejasvi, what pose is
It's the
that?
warrior pose.
It's a warrior pose. Yeah, I am messed up with
Yeah, yeah.
the names of
Yes.
the asanas. Okay, so it's very important. Like I'm talking about knees, likewise, you keep your elbows also soft. See, it's beautiful that the biceps will work, triceps will also work if you keep it soft, and you will not strain your joints, right? So avoid locking of joints because when you do in an asana, it also becomes a habit. I've seen people who always stand with hyperextended knees. Their glutes are not working, their hands are not working, everything is shut down, right? We don't want that. So a lot of our daily routine things, how we stand, how we walk, how we sit, are very crucial in how much we are going to be able to recruit our muscles and do an asana or any form of exercise properly. So just make sure that your primary framework is sound, right? And if it is not, have a consult with a physio, find out a movement therapist, and get it sorted. Avoid overstretching, avoid over exerting. Partnering is a wonderful thing if you have somebody with whom you can, for support. Generally taking support is taken as a sign of weakness, but when we do it with a partner, it becomes more motivating that together we are able to do better and it becomes fun. So partnering and doing it is a great idea. Knowing the caution and contraindications. Now certain postures, in fact almost every I think other than the most easy ones, a lot of postures have certain contraindications. Anything you're doing on the wrist and you're going to be forward, it's contraindicated to be done in pregnancy. If you have a carpal tunnel syndrome, you wouldn't want to do that, right? The wrist tissue. So it's important to know the cautions and contraindications. Complementary training. By complementary training, so we generally do this a lot for athletes. So their primary thing could be, say, for a footballer, we are doing a lot of sports specific work and we are doing strength and conditioning. To complement it, to make him better at football, I will add something that is completely different and I'll add yoga or I'll add Pilates. Likewise, if you really want to improve your yoga, you could start doing something ex- absolutely different with movement. It really works because the way the muscle recruitment and the patterns, everything changes and your body starts performing better. So if you're really looking from a performance perspective, this really works, and this is the thing in the movement world right now. It's very important, lastly, not the least, to follow a disciplined, goal oriented practice. In this, I cover everything: having a teacher, having a routine, listening to the body, not overdoing, having a clear thing in your mind, what you're doing, why you're doing, and when you want to achieve it. Right? And last, always listen to your body, have a beginner's mind, right? Don't forget that shavasana, it's very important for your body to relax, for your nervous system to slow down and shut down. Don't rush for the door to open, don't rush to the kitchen to cook. Have that 2 minutes of shavasana for yourself to completely relax and be there. With that, I will end today's session. Have a blissed out yoga practice and not a stressed out yoga practice is the take home message.
Thank you so much, Tuheena. She'll also be leading us into a meditation as well today. And before we take up the questions, we have a few questions from YouTube, and I think people here also have asked, some of them have asked. So we'll take
Sure.
up questions after this. So I think we can do the meditation first, if it's okay.
Yeah. Yeah.
Okay. Okay.
All
So
right. So we talked a lot about the physical aspect of yoga and the physical injuries. There are a lot of emotional injuries that also happen on a day-to-day basis. Yoga is wonderful and amazing that way that it takes care of that as well. So meditation is my favorite component of yoga, which really takes care of your mind and your physical and your mental health. So we are going to do a quick 10 minutes of meditation. I'll lead you into the meditation. And before that, Do you want to do Bhastrika or something, Khushpinder, or we do 10 repetitions of Bhastrika. It's called bellow breathing. So how you do Bhastrika? It's very simple. It's my favorite because it causes an instant gush of energy in the body, right? Uh, you keep your loose fists in front of your shoulders. When I say breathe in, you will forcefully breathe in and you will open the hands and the hands will go out. And when I say breathe out, you breathe out forcefully and you breathe out forcefully and make fists by the sides of the body. So it's as simple as that. I'm going to give a count and you're going to follow that with forceful breathing and eyes closed. So take a deep breath in, loose fists in front of your shoulders. Another long deep breath in and completely relax your body. Place the entire weight of your body on the chair or the seat that you are sitting. And with the count, we will do Bhastrika. 10 rounds. With a forceful breath and enthusiasm, breathe in, out, 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 in, out. Breathe in, out, and relax. Keep your spine erect, body still. Take a normal long breath in and breathe out with a smile. The first stretch in yoga is smile. Take your attention to all the sounds in the surroundings, whatever noises they are, keeping our eyes closed. The noise of the fan moving, distant traffic. Without much effort, listen to all the noises. Accept all the noises as they are. Take a deep breath in and let go. Take your attention to your body. Whether it is in pain or comfortable, just let that be. The body is a beautiful gift from the nature. Relax your body more and more. Take your attention to your thoughts. Positive thoughts or negative thoughts, just let them be. Take another long deep breath in. And relax more and more as you breathe out. Take attention to your feelings, feeling happy or sad. Just let that be. Again, becoming aware of your body, the environment. Take a long deep breath in and let go. You are peace. You are joy. You are love. Slowly and gradually, becoming aware of your body and surroundings. Bring your hands in front of the body and rub the palms slowly against each other and place them on your closed eyes. And bring your palms on the thighs facing the ceiling. And you may open your eyes and come back.
Thank you so much, Tuheena, for the beautiful meditation.
So, what should we do now, Kush?
We have some questions. So our audience on we have some questions here also, and some from our YouTube viewers as well. So we have a question. I was doing Ashtanga yoga and I felt it placed a lot of strain on my wrists. Is it important to do things like pull-ups and stretch the wrists in the opposite direction as well, as I felt a lot of strain in a single direction on my wrists with
This
Ashtanga
question is here or is it from YouTube? I can't see the question here.
from YouTube?
Can you repeat the question for me, Kush?
Yeah, I was doing Ashtanga yoga and I felt it placed a lot of strain on my wrists. Is it important to do things like pull-ups and stretch the wrists in the opposite direction as well?
Yeah, so Ashtang, as I understand, requires a lot of strength, and we generally do not have that kind of strength in our wrists. So I would suggest going back and doing a lot of strength and conditioning so that you have good muscle strength in and across your wrist. Second, very common thing why the wrist tends to give in, because you do not have a strong shoulder stability. So, like you have your core, which stabilizes your spine, and then you do everything with your arms and legs. You are able to perform better. Like that, your shoulder blade, your scapular stability is very important. So I can't pinpoint whether you should do pull-ups, what kind of exercise you could do. I think you will have to undergo consult and see, get it checked with a physio and figure out what are the weak links in your body. But definitely you have to go back and work on your weak links, on the strength conditioning component, for the for the upper body. Yeah, because what is why the wrist is getting strained, its reason could lie somewhere else, and it could lie here also. One would be able to assess you, examine you, and then tell you what kind of exercises would be needed. Yeah.
Next, we have a question here. Um, Someone had asked, in Chaturanga, we keep our elbow slash hand straight, right? In Chaturanga, it's bent, just like she had shown in the video, in the photo.
Yeah. Yeah.
I think you can just check out Chaturanga tutorial on YouTube. You'll be able to understand what Chaturanga is. We have several practices here also where we have done that. So you can just check out Surya Namaskar, a video on our channel as well. So over there.
So Tejasvi had said that because we discussed Chaturanga today in detail, she will be putting a tutorial with the use of some easy props which you can find at home. She's going to put it on Monday or Tuesday.
Yeah, we will be putting on that video tomorrow. So that is how to use a yoga rope to make the poses easy as well. So it's going to be for a rope. Another one we have is, I used to do yoga regularly, but then I got a sharp pain on my glutes and hips. Should I take rest? What else can be done to improve my situation?
Okay, I need to see you. So the thing is, a sharp pain in the glutes. I don't know if it's coming from your lower back, if you have an irritated nerve, or is it your hip mobility, which is less. You don't have that mobility in your hips, and that's why there are so many muscles even under the glute. There are like 10 small muscles under the glute, which actually stabilize the hip. So rest definitely will help. It'll help you heal. It'll help the tissue heal. But then there's something going wrong with your practice, why you are getting it right. That cause needs to be addressed, and that we will be able to identify when you give a detailed history as to what has happened, when we are able to examine you, and then we boil down to what exactly is needed to improve the situation right now. So as of now, I would say if it's really acute, I sit. Um, Gentle stretches, graded stretches, not like pushing and pulling, but gentle graded stretches for the glutes will help. But why it is, I mean, that's just because you say that your pain is in the glute area. It was a sharp pain in the glute. So rest, eyes, gentle graded stretches, something like knee to chest, make a figure of four, take it towards the chest very gently. Uh, and then just get a consult, get a movement screening done to find out why this has happened, and we address that. Yeah.
We have one more from YouTube. I have hypermobility. I have 360-degree rotation in the shoulder joint. Whenever I do pincha mayur, I feel intense pain near the shoulder blades. What must I do? I've heard more the range of motion, the lesser the stability. Should I be doing pincha or not? Or should I develop strength without going upside down?
So doing what? There was a pinch, Kushpinder, while
I
doing
think pincha mayura. This is basically the forearm stand.
Mayura. Right, right. So it's an advanced pose, right, Kushpinder?
Yes, yes.
It is an advanced pose, yeah. So yeah, I think it will be better to get back and get a shoulder exam done. We can even do over a video consult. If you would want me to do it, I can have a look at your shoulder. And since you say you have an extra range, you have a hypermobility, Mayurasana, it requires a lot of stability from your shoulder. Okay, so there are small rotator cuff muscles within the shoulder. which which actually, because it's a ball and socket joint, it is like this. So to keep the ball into the socket, these small muscles have to really make sure that this ball is moving right. So they have to be functioning 100% in that range, that demand which you are putting in your mayurasana. So you might need some preparatory strengthening exercises which will help you achieve your mayurasana without getting the shoulders strained. So you have to have a specific shoulder muscles and your scapular blade, because the other component is your blade. If your blade is not stable, again the pose is not going to be comfortable. So both the surfaces have to be very stable. There's the cuff working for this. There are a lot of muscles that work on the stability of this. So these are the muscles that we really want them to work very well coordinated with your core for you to work to achieve the mayurasana, which is a challenging pose. So you need a very specific exercise program depending upon the demands of your mayurasana. That is what you need. Yeah. And don't be scared of hypermobility at the same time. I know it feels you feel that you are more prone to injury when you are hypermobile, but if you are doing a good strength and conditioning, a good strength training program, you reduce the chances of uh, injuring yourself. And there's a lot more also that can be done from a physio perspective to make sure that you don't end up in injuries when you are trying to do advanced yoga postures.
Thank you for that. And I had one question for you because you mentioned a lot of things about good posture. So, can you give a
Yeah.
few tips on how a normal person can maintain good posture?
Yeah. So, so posture has become very overrated. I'm gonna talk more in terms of alignment. How is your head aligned with respect to your shoulders? How are your shoulders aligned with respect to your torso? So the common thing that happens, if I see majority of the people who have desk job, we are always into, our hands are there and our necks are there, so we tend to have a chin lift. So if you see white collar jobs, they have, the posture is this, where there is a chin tuck. So there's something that is the neutral, which is in between both. First thing is, you need to observe yourself while getting into your work. Do you tend to get into a chin lift? You need to make sure that you are into the neutral. So how do you find this neutral? It's very simple. You look up to the ceiling, you look down, you come to the midpoint, you look left, you look right, you come to the midpoint. That's basically that is how you find out the midpoint of your neck, particularly the lower neck. So left, right, center, up, down, center, full ranges. And then to prevent the chin poke, you need to do nod and come to the center and stay there. So initially it's going to require practice, because every time you have to put your mind into it to find out your center. But as you practice, that particular center gets registered, and you automatically start being there like you are in the wrong posture. So that's about your neck. Second, I want to talk about your lower back, because we have the habits of sitting slouched. We don't sit as tall as we can, and we are sitting there. So that happens with a lot of us. So one very simple mantra is sitting as tall as you can, and making sure that nobody can punch into your belly, right? There has to be some tone in your muscles. It should not be floppy over there. So engaging your core even when you're sitting, like how you try to engage your core into your asanas, likewise engage your core in sitting. And check with your glutes. Like I said, there's this thing called as glute amnesia. You walk, you do stairs up and down. Can you feel your glute working? If you're not feeling your glute working, I think it's a good idea. You start doing some glute specific workouts. Uh, Yoga helps a lot activating the glutes as well. Certain lower body postures wherein you try to pressing your heels into the floor, like you're doing a warrior pose. The moment you press your heels into the floor, you're able to activate your glutes. So likewise, in your daily activities, at every heel strike when you walk, are you are you feeling that your glutes are active? So basically incorporating your core even in your sitting, even in your walking. You're pushing a door, make sure you're not pushing just with the hand, your core is also engaged. So yeah, as an extension of the posture, these are the things that can be taken care of. So it's more about incorporating the muscle in everything that you're doing. So the resting posture is going to be fine when you're adding the muscle to it. Did I answer, Pushpinder, or did I
Yes.
give a lot of information?
Yes, I think that's useful. And someone is also asking, is there a website for video consultation? So
Video
if you do,
consultation, yeah. I mean, they can have I can share my number in the chat box here.
yeah.
Uh,
Or either you can just get in touch with us and send your
yeah.
contacts as well.
Yeah, you can get to Kushpinder or Tejasvi and they
We'll
can
connect
help
you.
you get connected to me. Yeah.
Thank you so much, Tuheena, for
Thank you for
being
having me. Thank you so much. And I'm very happy that I could do this. I have not been doing any of the online work in a long time, be it teaching courses or, for 2 months I've not been doing. And today it felt really good because it was a combination of what I professionally practice and what I love. So it was really nice. And it gave me an opportunity to really go back and read also because I really wanted to send across things that are useful. So thank you so much for having me. Yeah.
it's really so nice, to have all these speakers come up and give their best to us. And I think all of us learned so many things today. So I just wanted to share, a little bit of my experience as well. I had a couple of, I had a really bad injury. I had an accident, and after which I had a knee surgery. And after that, I was more prone to injury. I realized I had to really change the kind of practice that I did before and after. Mm. So one of the time I had a back injury, and after that I realized that using blocks helped me so much. I've always been very flexible, but I felt that it's very easy to just go into that injury again once you start practicing. So even if someone who has been injured, it's a really good idea to take it slow. Like, yoga is not about competition. Yoga is about getting to know yourselves better. And one of the things which everyone can do is see the kind of practice that you need to do. Ayurveda says that you should be doing only up to half your capacity, up to your balard or ardh shakti. And it also says there are like signs that can tell you what is your half capacity. So it says when you start breathing in through the mouth, that means you are crossing your half capacity. If there's sweat that start coming in different joints in the body or on the upper lips, that means you're crossing it. So few times I think it is okay, few seconds it's okay, because in the beginning we have a mild practice, in the middle somewhere you're doing a little bit of intense, and throughout if it's a moderate one, but just make sure that it's not always above your half capacity. And also your prakriti plays a role in what kind of practice you should be doing. So there are several things where you can find out what kind of prakriti you are. So vata people should not be doing very intense exercises. Pitta can do a moderate exercise. Kapha people can do like high intensity exercises. But if a vata person does very intense exercise, it is not good for their health. You can look very good, you can have those abs, but you will not be healthy, which is not really, which is counterintuitive to fitness. So just see what your body supports, feel that love for your body, and then you move. If you want to practice yoga as well, we have a lots of yoga practices on our channel, and this video also will be available on Fit and Calm YouTube channel, so you can check out Fit and Calm Yogic Living for that as well. And every Sunday 4 p.m. we join in here with either a topic that's on yoga or Ayurveda, or chanting something that's connected to healthy living, towards yogic living, and the ancient culture that we have. So, thank you all so much. We'll be putting out the video tomorrow for how to use the yoga rope and how you can modify postures in that. And join in for next Sunday as well. So, thank you so much for joining us. And Tuheena, once again, thank you
Thank
so
you.
very much for taking out time for
Thank
this
you.
today.
Thank you. Thank you. I'm happy I could do it.
Okay, guys, see you all. May you stay fit and calm.